for virtual Medicare and Social Security planning made simple presentation. This is one of the 8 informative and empowering sessions in the Oktoberfest 901 Personal Finance series, aiming at helping our customers to take charge of their personal finances. For the next 2 hours of today's presentation, it is designed for those turning 65 and older who need to make a decision on Medicare and would like to be more educated during this overwhelming time. Our expert, Craig Long, will share what Medicare covers, doesn't cover, Medigap options, and the prescription drug choices to consider. After this first hour of presentation on Medicare, you should have a clear understanding of what plan is best for you. In the second hour, you will learn about types of Social Security benefits, what's the best age to claim, how benefits are taxed, and other important considerations that will make significant differences in your lifetime Social Security payments. Craig Long has been an insurance advisor to seniors, families, and businesses since 1993. He knows one of the most important yet confusing decisions is what to do regarding your Medicare when you turn 65. He has been sharing his knowledge and expertise on Medicare and Social Security to library customers throughout the state of Tennessee and is a repeat presenter for Nashville Metro Library System and Memphis Public Libraries. So this session will be recorded, and when you are not talking or listening, please mute yourself, and we will have floors for everybody to speak. So when you are about to speak, you can unmute yourself. So now let's give our speaker, Craig Long, a warm welcome. Mr. Long.
Great, thank you so much, and thank you for everyone that's attending. I appreciate the Memphis Library System allowing me to do this to hopefully educate people on Medicare and Social Security this afternoon. So let's go ahead and jump right in. After the Medicare one, we will take a 5-minute break just so we can kind of stretch our legs, and then we'll come back and do the Social Security one after a 5-minute break. So it is Medicare, as it says on the screen. It is simple once you understand how it works. And so hopefully in the next hour on this topic, it will make more clear sense on how exactly this works. So the first thing I do need to tell you is I do not work for the federal government. I'm not with Medicare. As Wang Ying said, I have done this for 29 years now. And so I've worked with a lot of people over the years, helping them through this process, getting them the right stuff that they need to get to make educated decisions for themselves. So most of the people that are probably on this webinar this afternoon are probably in this arrangement as far as they're entering the maze and trying to figure out what in the world do I do, when do I do it, how do I do it? And so that's what we're going to hopefully make some sense of as we go through this. I just went one too many. Let me go back to that. So anybody that's turning 65 in the next 90 days typically will get this mailed to them by the government. And it just is about a 140-page booklet that will go through all of the things that we're going to discuss today. But obviously today we're going to narrow it down, kind of gives you a Cliff's Notes version of how all this works. This is available, by the way, on Medicare.gov. So if you do want to get it, if you don't have it, go to Medicare.gov and it will be on there. If not, at the end of the session, it will have my name, number, and email address. So if you email me, I'll be more than happy to send you a PDF of it as well. So one thing I like to start off on is that the differences between Medicare and Medicaid. I find that a lot of people that I talk to sometimes get those a little confused. So just so we're on the same page, Medicare, of course, is an entitlement of health insurance provided by the government. It's typically for people that are 65 and older. You can get on it if you're under age 65, if you have certain disabilities, and also if you have end-stage renal disease, you can get on it at any time. Now with Medicaid, Medicaid's a joint federal and state program that pays for medical costs for those people that have limited income or resources. So if they don't have a lot of money, there's a limit of what they have, and if they have below that, then the government will help out with some of the cost when it comes to this. And when we go through this, if you see anything that says dual eligible, what that's talking about is somebody that is on Medicare and Medicaid. They have both of them. Now, as far as the plans go, the plans are the same. Nothing's any different. It's just that people that need assistance from the government through Medicaid will get some assistance for some of the costs that we look at as we go through this. Okay. Now, as far as the parts go, what we're going to talk about today there's 4 key parts with Medicare. You have Part A and B, as you can see on your screen. There's Part C, which is also called Medicare Advantage plans, and then there's Part D, which are the prescription drug plans. And so the first 2 we'll run through, as you can see, are the Parts A and B. And so the easiest way to remember it is exactly what you see on the screen is Part A is hospital coverage, and Part B is basically going to be your medical services or doctor coverage. So if you just remember that A's hospital, B's doctors, you're going to know about 90% more than most people right now. So that's just real easy to remember it. And when you get your Medicare card, it'll say on there hospital coverage and medical coverage. So it's real easy to understand the difference. So as far as how Part A goes, here's basically how the Part A hospital coverage works. Medicare will pay for a semi-private room, inpatient hospital services and supplies, skilled nursing care with a 100-day maximum, which we'll talk about that a little more in a second, hospice care, and all but the first 3 pints of blood. And I know sometimes the blood thing sounds silly, but that's just the way it's always been. And what it does not cover is private duty nursing care, private rooms, personal care items, custodial care, or long-term care insurance. So they specifically exclude those things. Now, if you're admitted to the hospital in 2021, these are 2021 numbers, and every year these do go up a little bit. They have not announced what 2022 numbers are yet. So in 2021, if you were admitted to the hospital, there is a $1,484 deductible due when you're first admitted to the hospital. Now, that is not an annual deductible, that is per admittance deductible. So if you went in the hospital several times over the course of the year, you would have to meet that. Now, before anybody gets alarmed on that $1,484, when we get into Medicare Supplements and we get into Medicare Advantage plans, typically those are going to cover all of that or a big portion of that. So you're not going to be on the hook for that. So don't be alarmed to that. We'll kind of get into how that's going to be covered here in a minute. But if you did not have anything else other than just straight Medicare, you didn't do anything on the side, this is the way it would work. So once you've paid that deductible, the next 60 days are covered 100% by Medicare. So you would not pay anything for that remaining hospital stay unless you went to 61 to 90 days. And if you're in the hospital during that amount of time, you would pay $371 per day for each day that you're in the hospital during that month. If you're there between 91 to 150 days, you can see it goes to $742 per day for each day you're in there for that month, or that 2 months, I guess, the 60 days there. Now, if you're in there longer than 150 days, which, hopefully that's not the case, but if it was, that you do have what's called 60 lifetime reserve days that they will also pay on top of that, but it would be covered with you first paying $742 a day for each day you're in the hospital, with them paying the rest. So you can see it gets a little expensive if you're going to be in there for an extended period of time. But as I mentioned, if you were to go on a Medicare supplement type of plan or a Medicare Advantage plan, you wouldn't be responsible for that because that plan would probably pay all of it, if not all of it. And we'll talk about that obviously coming up in a few more slides. Okay. Now, skilled care, I mentioned over on the top left a minute ago that they cover a maximum of 100 days. And so this is something that anybody's doing, good planning for them, especially if they've saved any money along the way and they'd prefer not to spend it all in case they have a health concern. So skilled care is only covered if you're hospitalized for 3 consecutive days. So if you're not in the hospital for at least 3 consecutive days, this won't work. But if you're in there for at least 3 days or longer, and your doctor and Medicare both agree that if you receive skilled care, whether it be in your home or in a facility, that would improve your condition. Now, that's the key thing, is it has to improve your current health condition. If it's maintaining or they see no reason that it's going to improve by doing that, then they can deny you getting that benefit. But if it would improve it, you can see that the first 20 days are paid 100% by Medicare. Day 21 to day 100, you would pay the first $185.50 and they would pay the rest. And after 100 days, if you still needed skilled care, that they would not cover that at all. So that is all on you. And by the way, that is the one thing there that also Medicare Supplement or Medicare Advantage plans do not cover after the 100 days either. So there's where a lot of people that if they're doing planning again and have saved some money, they might consider getting a long-term care insurance policy to cover once Medicare quits paying after the 100 days, then that long-term care policy would provide additional coverage for them if they needed it because of their health issue. Okay, any questions on that so far? So just remember that Part A is hospital coverage, okay, and that's the basics of how it works. Now, is there a charge for Part A? The good news is 99.9% of the time the answer is no. So here's the rule. As long as you've worked at least 40 quarters, 10 years, or you're married to someone that has worked for at least 10 years in their life and paid FICA taxes, obviously, during those 10 years, then Part A is free for them and their spouse. Okay? Now, it can cost for somebody that hasn't worked at least 10 years or has not been married to somebody that's worked at least 10 years and paid taxes during that time. And you can see on the bottom that if they've only worked 30 to 39 quarters, that the cost would be $259 a month. And if they've worked less than 30 quarters, the premium is $471 a month. For what we just saw on the previous page for Part A, that's what the cost would be for those particular people. Now, most of the time what I found is we run into that if somebody has moved to our country and just hasn't worked 10 years yet. So there's where working 10 years is vitally important so that they don't have to pay that cost. Okay, but for anybody typically born in the United States, has worked 10 years or married to somebody that's worked 10 years in their life, it's free. So you would always sign up for Part A when you turn 65 because there's no cost to it. Okay, so Part B, this gets into, again, the doctor coverage stuff, the medical supplies and services. And this is kind of your old school 80-20 stuff, right? So Medicare is going to pay 80% of the bills and you'd be responsible for 20% of those bills. And you can see that it covers any services and supply needed to diagnose or treat your condition, prevent illnesses, durable medical equipment, ambulances, clinical research studies, second opinions for a surgery, and then some limited outpatient prescription drugs. And you can see a couple examples there, but Medicare itself does not cover prescription medication. There's where you have to get a separate prescription plan, which is the Part D that we'll get into here in a few more slides as well. So they do cover some limited ones as far as nebulizer pump, injectable, CPAP machines is another big one nowadays. And so those are kind of the things that are covered under your Part B. Okay, but 80-20. Now again, a supplement or a Medicare Advantage plan is going to cover that extra 20%, which we'll talk about coming up. Now, what does Part B not cover? And this is important because a lot of people think that they're going to get this stuff. So it does not cover dental care, does not cover eye exams related to glasses or contacts. Now, obviously, if somebody has glaucoma or macular degeneration, those things are covered because that is a medical condition versus just my eyes aren't good and I need to get glasses. Cosmetic surgery is not covered, acupuncture, hearing aids, routine foot care, and again, long-term care, as we mentioned before. So those are the key things that they specifically do not cover. Now, at the very bottom, you see where it says What's Covered app. So if you were to go to the App Store and you type in What's Covered, that is the Medicare approved app. So there's where you can go in and put in conditions, look and see how something's covered, not covered, will it be covered? And so if you want to check that out, that is the one Medicare approved app. And you'll see an M on the app when you do it. It's green and dark blue, but What's Covered if you want to go and check that out. Okay. Now, Part B, we mentioned Part A has no cost to it. Part B does. And so here's where sometimes people get a little shell-shocked. because it is based on your past income. So your Part B premium is based on your income level and will be deducted from your Social Security check if you're receiving Social Security when you sign up. If you're not receiving Social Security when you sign up for Part B, because you're going to delay it, which of course is our next topic, but if you were to delay it, then they're going to bill you quarterly for the monthly cost. So 3 times, right? Every 3 months, they're going to bill you on a quarterly basis, and you just got to send them in the money. So I'll show you the chart here in a second. Now, it says here that Part B is optional. So the only reason it would be optional is for those people that are going to continue to work and be provided a group health plan through their employer. Individual health insurance does not count as a qualified plan. So if you have an individual plan through the exchange or something like that, you have to go onto Medicare when you turn 65. But if you have a group plan, you can delay going on to Medicare and continue on your group plan if that's a better deal for you. So there you would not sign up for Part B. You would continue on your group plan and delay going on to Part B. And you would not have any penalties or anything that would be held against you because you stayed on what they call a qualified plan. Now, if you turn 65 and for whatever reason you just decide that you're not going to sign up for it, you have no other qualifying coverage through a group, then what they're going to do is they're going to impose a future 10% penalty on top of the numbers we're going to look at in a minute for every 12 months that you decided not to enroll when you were supposed to when you turned 65. So, for example, if you didn't do it at 65 and you just delayed it till age 70, they're going to impose 10% times 5, so a 50% penalty on what your Part B premiums are for the rest of your life. So not a good idea to do that. In my 29 years of doing this, I've had 2 people that just didn't do it. They chose not to, even though they were told not, that they shouldn't, and they ended up deciding to go on in the future because of some health reasons, and they had a significant penalty on top of the premiums, which is not a good idea if you do the math usually. So we mentioned about Medicaid. So if somebody's on Medicaid, then the premiums that I show you on the next slide, there's where they get some help or all help, or they don't have to pay that because, again, of their income level that they're at. And then Part B of Medicare has an annual deductible, and in 2021, it's $203. In 2020, it was $198. They have not announced what it is for 2022 yet. Normally, they do that sometime in early November, so here soon. But it's $203, and we'll touch on that as we go through Medicare Supplements here in a couple more slides. Okay? So now with the, just went past the one. All right, so here's the Part B premiums. So here's how this thing works. What they do is they look at what's called your Modified Adjusted Gross Income, or MAGI is the abbreviation. And so they look at what your Modified Adjusted Gross Income level is, and they look at, see, did you either file your taxes as an individual, a joint, or married filing separately? And you can see based on where your income level falls, household income level, depending on how you file taxes, you can see on the far right what the monthly premium is. So in 2021, the monthly premium for Part B is $148.50 is the cheapest one. And you can see if somebody has made more money, that their numbers are going to be where their numbers fall on the chart. Okay? Now here's the other bad thing, unfortunately, that comes along with this, is they don't just use your taxable income, they also take into consideration any tax-free income that you also received. So here's where we could have someone that has saved money in a Roth IRA or a Roth 401k, which has done a great job. They already paid the taxes on it, right, before they put the money in. The money grew tax-free. They're taking that money. They're not being taxed on it because it was taxed previously. But according to Social Security and Medicare, they're going to consider that income, even though you didn't have to pay taxes on it, on top of any income that you received that you did pay taxes, to come up with a total number for these charts. Okay, so there's where unfortunately they get you a little bit if you did the right job. And so if you are going to be in a higher bracket than the $148.50 monthly premium amount, What they do is after you sign up for Part B, you get a letter in the mail from them letting you know that the standard premium is $148.50. However, they have imposed what's called a income-related monthly adjustment amount, or what they call IRMA, which is in the very bottom left-hand corner, as you can see. And an IRMA penalty is where they would say the standard number is $148.50, but you are going to have an IRMA penalty of whatever number it is to get you to whatever number the total is. So if you were at the $207.90, you would get an IRMA penalty of what, $59 and a couple cents or something, if that makes sense. Okay? Now, before anybody gets alarmed, a couple last things on this. What they do as well is they go back and look 2 years previously at what your income was to determine what these numbers are. So they go to the IRS and look at your tax return to determine what these numbers are 2 years previously. So of course, a lot of people prior to retiring are making as much money as they have, and so they're going to maybe be in a higher bracket. And so now they're retired and their income's going down, but yet they're looking 2 years back in order to figure out where they fit. Now they got a higher number here. So you do have the right to appeal. However, a lot of times they don't lower it just because you're retired. Because if you were making a higher number, they feel that you probably should have saved some money so you can still afford it. And then what they do is they say, okay, well, next year, when we look 2 years back, if your income bracket was in a lower one, then you can appeal then, and we will lower your number. So let's say that somebody as a joint tax return was making $250 in 2019, they're going to be paying $297 in 2021 for their Part B premium. But next year in 2020, you can file an appeal if your income, let's say, was $200,000 and it went down from $250 to $200. So you file an appeal, they look back and say, yep, your income was $200,000 in 2020, so now we'll lower your premium from $297 to $207.90. And then let's say in 2023, now they look back in 2021, which may be the year that you retired, and okay, now your income's less than the 176 on a joint return, and they go, okay, yep, now we're going to lower your rate down to the 148.50 on a monthly basis. So you're not stuck at a higher number for the rest of your life, but unfortunately you may be for a year or two until you can file an appeal when they do that 2-year look back to get you to a lower level. Okay, so unfortunately it's not something that's fun to pay, but it is what it is. There's no way to get around it unless you're a Medicaid person, but that's just how it works. And every year these numbers do change a little bit. So last year it was 145, it went to 148.50. Again, they haven't announced what 2022 is yet, but obviously we expect them to go up. We just got a 5.9% increase in our Social Security for next year is what they did. So I'm hoping they don't change this 5.9% as well to match it, but you know, we'll find out when they announce it. Any questions on how Part B premiums work? And again, they will either take it out of your Social Security check if you're collecting Social Security, or they will bill you quarterly for whatever number you fall into. Okay? All right. So let's now get into what plans we're going to pick to go along with our Medicare A and B. So we have two major choices. We can either pick what's called a Medicare Supplement, or it also is referred to as Medigap plans, and that would go along with your A and B that we just talked about. Or I can make a decision to go on to what's called a Medicare Advantage Plan C. So I cannot have both. I cannot have a Medicare Supplement or Medigap plan and a Medicare Advantage plan. That is illegal. They will not allow it. So you can only pick one or the other. And again, we'll go through the options here. Now, a prescription drug plan. If I went on a Medicare Advantage plan, typically those are going to include a prescription drug plan with it. So I do not have to buy a separate Part D prescription drug plan. However, if I went on the Medicare Supplement Medigap plan route, I would have to buy a separate standalone prescription drug plan because, again, Medicare does not cover prescriptions. So if I was to go on the top one, I got to pick the prescription drug plan to go with it. If I pick an Advantage plan, I'm doing that one, and that's it, because it's going to cover the prescriptions with it. Okay? And again, we'll run through all these, how they work, coming up on the next slide. As far as supplementary benefits, for the sake of time today, we're not going to go through all of these, but these are things that Medicare, again, specifically does not cover. So these are things that people can do on the side. They're offered by various companies. And so if you want to get some additional information or look at something there, obviously email me, call me, text me after we're done when you get my information. But dental, vision, home care, nursing home, assisted living care, hospital indemnity, which is going to cover some of the hospital costs if you're in there so you don't have to come up with that money, heart attack, cancer, accident type plans. So those are kind of the key ones that people tend to look at. But again, optional, not required. The top ones here, the first three, those are the ones you have to do to avoid penalties. Okay, so let's get into what a Medicare supplement, or what's often referred to as Medigap policies, are. Now, here's the beauty of this. This is the one time in your life that you actually are going to shop for something and the coverage is identical. Nothing is any different. Not one word is different. It's exactly the same no matter what company you look at. So that's the beauty of it. Okay, so because it's regulated by Medicare, they have to be exactly the same. They do not allow them to have anything any different. Okay, so it doesn't matter if I pick company A or company B, exact same coverage. What's the difference going to be? The cost, what they charge me. And we'll get into some basic costs coming up here in a minute on what some averages are. But that's the only difference because the coverage is exactly the same. Now, again, if I go the Medicare Supplement Medigap route, I have to include a prescriptions Part D, or what they call PDP, prescription drug plan. I have to add one of those because, again, Medicare doesn't cover the medications, as we mentioned. Okay, so here are the types of plans that are available for Medicare Supplements / Medigap plans. This is regardless if you're in Memphis, or you're in northern Mississippi, or you're in Arkansas, or wherever, right? So they all are exactly the same. So that's why there's no company name on it, because they're identical no matter what company you go with. But what they offer is plan A, B, D, G, K, L, M, and N. Those are the plans that are set up by Medicare that carriers can offer. Now, not every carrier is going to offer every one of those. And to be honest with you, they could offer about 2 or 3 of them and get rid of the rest because nobody picks the other ones anyway. The one that is the most common, I would say that 90-some% of the people get, is Plan G. And the reason they pick Plan G, because you can see all the different check marks that are on that column there. So on the column, the only one missing is the Medicare Part B deductible. If you recall a few slides ago, I had mentioned that in 2021, the Part B deductible is $203. So basically, if you were to have Medicare Part A and B, you signed up for a Medicare supplement plan with whatever carrier you chose, you would have 100% coverage for all of your Medicare or all of your medical needs, of course, approved by Medicare, so non-elective, all those things that obviously are covered, medically necessary. But any medical care you receive, whether it be at doctors, hospitals, anybody, and you can go to any doctor, any hospital you want, as long as they accept Medicare anywhere in the country. There's no list you have to use, anywhere you want, right? You just have to pay the first $203. After that, 100%. You pay nothing. That's pretty good compared to probably any health plan anybody's ever been on. That's pretty limited as far as your out-of-pocket cost. All right, so that's the reason that Plan G is the most popular, because you know you pay a little bit out of your pocket for the year, and after that, 100% coverage. All right, now to compare a couple differences. When I mentioned there might be 2 or 3 that may be on this list that are worth talking about, the rest could go away. Plan D. If you look at Plan D, it covers, again, just like Plan G did, it covers the coinsurance if you're in the hospital. It covers your Part B coinsurance, which is the 80/20, the 3 pints of blood. Medicare doesn't. The hospice stuff, if you qualify for that. The nursing home stuff, if you qualify for that. Skilled care. The Part B, Part A deductible, which is that $1,484 every time you're admitted to the hospital. The Part B deductible, again, is not covered on Plan D as well. But here's the big one missing, is the Medicare Part B excess charges. And basically what that means is by law, doctors can charge up to 15% over and above what Medicare approves for a certain procedure or whatever they do, right? So let's say you go in for a physical and they say, all right, it's $100 is what the Medicare approves for a physical, and you have Plan D. Well, that doctor could potentially charge 115 because 15% over 100 is another 15 bucks, 115. Well, if you have Plan G is going to cover that 15 extra dollars that was charged. Plan D, you're going to pay the $15. Now, you might think, well, it's only $15, but let's think about if you have quadruple bypass surgery or you have some other problem going on, right? And now all of a sudden the bill is way more. 15% is way more. So there's where you have to factor in what risk are you willing to take. Now, obviously, rates on Plan D are going to be a little bit cheaper than Plan G because you're on the hook for that cost. My experience is usually Plan D rates aren't as cheap, aren't going to save you as much money as you think it would to have that risk. So there's why most people go on Plan G. Okay, and again, we'll look at some numbers coming up here in a minute. The last one I would say that people tend to look at is Plan N on the far right. The coverage there is identical to Plan D as far as the two things you got to pay, the Part B deductible and the 15% excess charges if they charge that. Now it says copays apply for your Part B, which is your doctor stuff, right? So you would have a $20 doctor copay and a $50 hospital copay. That's it. So pretty limited still. Again, the cost would be a little cheaper than Plan D, which Plan D is a little cheaper than Plan G. There's where you can look at the numbers and make a decision if it's worth it to you. Totally up to whichever one you prefer, but Plan G overwhelmingly is the one most people go on. Okay, but the big thing to remember here, every company, exactly the same coverage. It's just going to come down to the rates. More importantly, not the rate today, but what the rate's going to be in the future, because unfortunately, Medicare supplement rates do go up typically every year. So you got to factor that in to your decision, because there might be a company that's cheap now, but they might not be in the future. So you got to make sure you pick the right one for you. Okay. So let's get into now Medicare Advantage plans, or what's referred to as Part C. So here is where we don't have a chart, unfortunately, because these can be different. They're not identical, yet they're going to be similar. So if that makes sense, but I'll kind of give you an overview of how this works. But you have basically 4 key types of Advantage plans to pick from. So the first one would be an HMO, which a lot of people are familiar with how an HMO works. You have to pick a doctor. You go to the doctors and hospitals in their network. You have to stay in their network unless there is a life-threatening type of situation. Then you can go anywhere, but it has to be that, okay? And typically you have to get a referral to go to other places. So they're a little limiting, but if your doctors and hospitals are in there and you're not going to travel a lot and you're only worried about an emergency if you're traveling, an HMO might be a good fit. Then you have what's called a HMO point of service, which is just like the one above it, an HMO. However, a point of service plan allows you to go out of the network other than just for emergencies, but you're going to pay a higher cost for your care. So there's going to be some more out of pocket for you. A preferred provider organization tends to be the most popular, which is a PPO, is what they go by, and it's the most flexible. It basically allows you to go, you have a network you can stay in, but you don't need referrals. They also have networks around the country. So for example, if I'm on a company here in Metro Memphis, but maybe I snowbird down in Florida for 2 months in the winter, well, that company that you're with in Memphis may have a network in Florida too, so you would still be in network there versus out of network. Versus a HMO or a point of service, you're going to be out of network if you're outside of the Memphis regional area. Okay, and then there's what's called special needs plans, or SNPs as they call them, and those are really designed for people with specific diseases. And by that I mean, okay, somebody has congestive heart failure, uncontrolled diabetes, HIV, different health conditions like that are serious health conditions. They have specific plans designed in your area. If you have that condition, the only way you can get on that plan is you have to prove you have that condition, but they have specific doctors, hospitals already set up that work together to make sure that they do the best job for you in that care. And so there's where some people go, I never heard of that. That's probably a good thing, I guess, because that means you have to have one of those conditions in order to get on one of those plans, but they are there for those people to have those things. Now, for how this is covered. So basically we saw under the Medicare supplement side, where you pay a monthly premium, you have coverage, you can go anywhere you want, right? And you just have a $203 deductible basically, and after that everything's covered 100%. Under an Advantage plan, it's going to be a whole different way. So an Advantage plan, a lot of these plans are what's called zero premium plans, meaning that there is no actual monthly premium that you pay to have this coverage, which I know most people are going, what? How do they not charge me anything? They don't. It's a $0 a month premium that you pay. You actually pay nothing, obviously, zero. So what it is if you were to go to the hospital, you would have a copay. And the copay is going to vary depending on the company you go with. So some of them might be $290 a day up to, let's say, 5 or 6 days. So you'd have to pay 290 days each day you're in the hospital up until their limit of 5 or 6 days, whatever that company's limit is. Some companies might say you have to pay $350 a day for 4 days. So if you're in there for 4 days, you're paying $350, so that's $1,400, and day 5 and beyond, 100% coverage. Okay? If you go to a doctor, a lot of them will have a $0 doctor copay for your primary doctor, but if you go to a specialist, then it might be $30 or $40 for each visit that you go to the specialist. Okay, and you might have a copay if you have to have an MRI or a CAT scan, or you need to do get X-rays. There might be different copays if you go to the ER, like $90. If you go to a walk-in clinic, urgent care facility, it might be $50. So under an Advantage plan, you're going to have a copay for a lot of situations where if you go, you know you're going to have to do that, right? So if you stay healthy, it's great because you don't pay anything for the coverage, but you're going to have copays as you use it. Okay, so way different than a Medicare supplement. There's where, again, you got to weigh both sides and decide which one's best for you. But again, most of these plans will cover prescriptions on them, so you do not have to add them. And when we talked about dual eligible people, the Medicare, Medicaid people, they typically have to go onto an HMO. Because the government's providing with free care, so they put them into an HMO. They typically don't get a choice, unfortunately, on picking one of the other ones. Okay, so questions on that? And again, I wish I had a chart for you, but there's just so many moving parts with all the companies, it would be impossible to do that.
Craig,
yes.
I still don't understand this Advantage plan very much yet. So when you do the Medigap, right?
Yes.
So it's a supplement plan. You have Part A, Part B, which covers 80%, and then this Medigap is supposed to help you cover the rest 20%, right?
Correct.
So is this Part C is also you have Part A, Part B cover 80%, and this Part C covers the rest 20%?
Good question. So you still have to have Medicare Part A and B.
Mm-hmm.
You still have to pay your Part B premium, okay, whatever that charge was. However, Medicare basically gets out of the way now if you go into an Advantage plan, and whatever carrier you decide to do your Advantage plan with, now they are your primary, and they cover everything after the copays instead of Medicare doing it.
But you're still paying the part, you still have the Part A, Part B, right?
Correct.
So that once you take the Part C, Part A, Part B, even though you're still paying the premium for Part B and they're not dealing with anything, Part C taking care of everything?
Correct.
So is it taking care of 100%? Or
it is after your copay.
After copay, okay.
After your copay, it's covering 100%. So there again, if you go to the hospital, you know, you'd have a $300 or $290 or $350 copay, and you would pay that copay for a couple days, whatever that company's copay limit is, and then 100% coverage.
Okay, so maybe later part, I don't know whether you'll do that. Can you evaluate, or for an average person, what is a better choice for them, Part A, Part B plus Medigap, or Part A, Part B plus partners?
Absolutely. So this is something individually, right? If somebody wanted to know what's best for them, there's where I would talk to them later and ask them several questions about their health, you know, and what doctors they want to use and different questions like that, because that would help me narrow down which one's best for them. I would tell you that if money is no object to somebody, right, and they could care less what something costs, they just got all the money in the world, most people probably ought to go on a Medicare supplement plan, because it is the most flexible and free plan to do whatever they want as far as get their care, get whatever done with limited cost other than their premium they got to pay monthly. If somebody's healthy, but they're concerned about cost, a lot of times a Medicare Advantage plan, as long as they stay healthy, is a better deal for that person, because they're paying nothing for their care. So they're saving all that money they would potentially be paying for a Medicare supplement and a prescription plan. They're saving that money, and I have a chart coming up on a couple more pages, but they're saving that money on a monthly basis, and you know, so they're profiting that money instead of spending it. So, you know, think of like a Medicare supplement like car insurance. You got car insurance and you hope to goodness you don't get in an accident, but you got it just in case. That's a Medicare supplement. You're going to pay for it no matter what. And then if you have an accident, you need to go to the doctor, obviously you got it, right? A Medicare Advantage plan, think of it like free insurance, but you got it if you need it, but when you need to have it, you're just going to have to pay a copay when that time comes. But you pay nothing to have the coverage.
Got it. Thank you.
Okay. I know it's confusing, but there's where when I sit down with somebody one-on-one and I ask them these questions, I show them both of them. I say, all right, here's all the carriers that do the supplements and explain them, and then I show them the differences with all the Advantage plan companies, and then that's where people usually know pretty quickly which one they think is best for them. Any other questions on that? All right, so here's our actual chart. Make sure I didn't skip a page. There we go. So here's kind of a side-by-side to kind of take us into what we were just talking about. But on the left side, obviously, is the Medicare Supplement Medigap plan. So like I mentioned, you can go to any doctor, any hospital in the USA, as long as they have accept Medicare, which there are some out there that don't, but overwhelming majority, of course, do. No co-pays on supplements. You just have your deductible, and after that, 100% coverage. You do have to have a prescription drug plan, which we'll get to in a few more slides. So your only cost here, of course, is going to be your cost through whatever carrier you select. You're going to have a monthly cost to have the coverage. And people that typically want to go this route, like freedom of choice, they know they have limited out-of-pocket expenses because they're just going to pay the premium and that annual deductible, and after that, 100% coverage, and they don't have to worry about referrals. They can do whatever they want, when they want, how they want. Versus the Advantage plan over here, there's where they have a doctor and hospital network. So you got to make sure your doctors and hospitals and everywhere you want to use is in that network. Otherwise, it's going to cost you more, and it gets pretty expensive if you don't use their network. You're going to have co-pays, as I mentioned, for various things that you have done. They have what's called out-of-pocket caps. And so an out-of-pocket cap would mean that if all of your co-pays over the course of the year add up to a certain number, then your coverage is, then you get 100% from there. You don't pay anything once you hit that cap. I'm here to tell you it's going to be really hard for somebody to get to that cap, because with the co-pays that you have for hospitals and doctors, it's really not a lot, and the caps can be anywhere from $5,900 to, let's say, $7,500 is kind of the range where they fall. So you'd have to go to the hospital a lot during the year, and I mean not just go once and stay there for a long time. You'd have to go in for a while, come back out, go in again, come back out, go in again, come back out, because again, there's only so many days you have to pay when you're in hospital. So it would be you're paying, coming out, you're going in again another time, and it's adding up over time. So I've never had one person yet in all the years I've done this that's gotten to one of the out-of-pocket caps, even with a lot of the health issues that go on out there. Even with a COVID thing, people say, well, with COVID, you're in there, but remember, COVID, you go in the hospital, you don't come out till you're done. So that's only a few days you're paying, so it doesn't really add up that much. Okay, so that's kind of to protect people, but it's really, I hate to say it's irrelevant, but it's really hard to get there for somebody unless they have a lot of issues ongoing throughout the year. It does come with a prescription plan, as I mentioned, And people that typically like Advantage plans are the ones that like lower or no premiums. So again, I'll pay anything to have the coverage. Doctors and hospitals, of course, are on the list, and I've got a prescription plan on it, so I don't have to go buy a separate one. So it just makes it kind of streamlined, I guess. So again, if money was no object and you won the lottery and you could just pay the premiums regardless what the premiums were, the Medicare Supplements the way to go because it's just total freedom. The Advantage plan has a lot of benefits to it. The other thing with Advantage plans is they do come with dental benefits, hearing benefits, and vision benefits. So where we talked about Medicare and Medicare Supplements do not cover dental, hearing, and vision. On an Advantage plan, you do get dental, hearing, and vision on those plans included. So that's enticing as well. So there again, where we would look at both sides, and then you got to make a decision when the time comes of which one you feel is best for you. Because it's got to be that person's decision, obviously. So before we move into prescription stuff, any questions again on supplements or Advantage plans? All right. So we kind of talked about a little bit of this already, but prescriptions, I'm either going to get it with my Advantage plan on the left, or I'm going to buy a separate prescription drug plan, PDP, on the side because I went with a Medicare Supplement, Medicare Medigap plan. Okay. So the way this is going to work then is who's eligible. Of course, anybody that goes on to Part A and Part B. Now, with prescription plans, you have to purchase one of these within the service area where you live. So, for example, if I live in Memphis and I retire now, and a year later I decide I'm going to move to Jackson, I would have to get a new prescription plan because they only cover in certain areas, and each area has a different one. So there's, they have their little area that they cover. If you move outside of that, you have to get another one. Now, there's no penalty to get another one. You just got to figure out which one you want, and obviously somebody can help you do that. If anybody qualifies for as dual eligible, obviously they qualify for the prescription plan. Now, I've had some people in the past that have been completely healthy, didn't take any medications when they retired, which good for them because that's pretty rare from the people I talk to. But they have no medications. They say, why would I in the world would I want to get a prescription plan and pay for something that I don't need? Well, the thing is, if you don't sign up for one when you turn 65, again, this is assuming that you're not continuing on your group plan. If you continue on your group plan, like we said, you don't have to do this until you get off the group plan in the future. But if I was to go not sign up for one when I turn 65, for every month that I wait to do it, I have a 1% penalty for every month that I chose not to go onto it from the day I turned 65. So I had some people last year that were 81 years old and they never went on to a prescription drug plan. They had used a Kroger discount card, which doesn't qualify as a qualified plan. And so figure 16 years times 1% for every month on top of the premiums that they had to pay is their penalty. So it added up pretty good. So not usually a good thing to do. Okay. So how it works. Here's where we'll make heads or tails of this thing. So basically there's 4 stages of Medicare prescription coverage. First, you have a deductible. And these are 2022 numbers, by the way. They were just released last week. So I updated this for today. So you have a deductible. The deductible typically only applies for name brand medications, not generics. So that's the good news is most people are on generics, so they should not have a deductible, hopefully, unless they're on a name brand. So the deductible in 2022 is $480. So that means if you're on a name brand, you'd have to pay the first $480 of your medication before you would move into the next phase, which is the initial coverage phase. Now, hopefully you're on generics, so you would wipe out that. We don't have to pay a deductible, and we start at the initial coverage phase, phase 2. So there is where you are typically going to have copays for your medications. So there is where you may have they list them in tiers. So a tier 1 would be a preferred generic, a tier 2 is a generic, a tier 3 is a name brand, and then there's a tier 4 and a tier 5 for specialty drugs, those type of things. And each tier has a different copay. So in a lot of plans, a tier 1 preferred generic may be a $0 copay. So you get that medication for free every month. So like metformin, a lot of people are on metformin for diabetes. And metformin is usually a tier 1 medication, so you'd get that for free every month. Okay, but when it talks about use the total drug cost up to $4,430, what it's saying is the cost of that medication, not what you paid, because obviously if you got it for free, the zero, but what the total retail cost of that medication was that the insurance company paid for it as well. So let's say that metformin was $28 retail, but you paid nothing. $28 is going to go towards the $4,430 limit. Okay, now let's say you had a tier 2 drug, and that would be just a regular generic. That might be a $5 or $10 copay on certain plans. And so there's where you might pay $5 or $10, but again, what's the total cost of the drug? That's what's going into the $4,430 limit. So to get out of stage 2, the total cost of your drugs have to go above $4,430 for the year. Most people on this are never going to get over that number. You're never going to get out of stage 2, especially if you're only on generics. What happens is, though, if somebody's on a name brand medication, there's where they might move into the next phase because the total cost of that medication is going to add up. For example, someone this morning was on Farxiga, and we've probably seen the commercials on this, but Farxiga is about a $700 medication. Now, the copay for that person, because that's a name brand medication on that plan, is $40. So they're going to pay $40 instead of $700 after the deductible, though, because again, it's a name brand. So that first month that they have the plan, unfortunately, they're going to have to pay $480 of the $700. Then in the initial coverage phase, the next month, when it's $700 again, even though that person only pays $40, $700 is going into the $4,430. Okay, and by the way, this is set by Medicare. This isn't something that's going to change from company to company. This is something set by Medicare, that this is the rules that they have to follow. Okay. So let's say that my total cost of medications go from $4,430 over the course of the year. Again, I didn't pay all that, right? I only paid some copays and whatever my costs were, but the total cost was over that number at some point during the year. Then what happens, you go into what's called the coverage gap phase. And anybody, if they've ever heard of what's called the donut hole, this used to be what's called the donut hole phase. So for whatever reason, they changed it to coverage gap phase. So this is where now you're going to pay 25% of your medications. So there's no copays anymore. Whatever that retail cost is of where you're getting your medication, you're paying 25%. Of course, the insurance company's paying the other 75%. And once your total cost of that gets to $7,050, so we already know we went over $4,430, so that next $2,620 of total medication costs gets added into stage 3. We're going to continue to pay 25% until we go above the 7,050 number, and then we go into what's called for the rest of the year the catastrophic coverage phase. And there's where you're going to pay 5% of that medication, or $3.95 for a generic, or $9.85 for a name brand, whichever is more, until the end of the year. These plans always go calendar year, January to December 31st, so every year it starts over again. Okay? Again, most people on this call are never going to get out of the initial coverage phase, stage 2. But if you do have a name brand, there's where you're going to probably fall into stage 3 at some point, and depending on how many name brands you're on, you may get into stage 4. So I know it's confusing because there's a lot of numbers and different things, but here's what I would tell you. If anybody wants me to help them, if they're getting down to this point, right, where they are turning 65, or even if they're over 65, because every year you can change and you can pick a new plan to go on to, there's where if I know what medication they're on and the dosage, I can run through our system every single company that's out there and be able to show you in more specific detail, obviously, here's what that cost would be, here's what they pay, here's what you would pay, and how it works in each one of these phases, and which phase you would go through over the course of the year. It makes way more sense than what this shows, but obviously without having a case scenario, this is where we're at. But any questions on kind of how the prescription plan works? And now this is the exact same whether you do a standalone prescription plan or you have a prescription plan on a Medicare Advantage plan. The only one difference would be on an Advantage plan, typically they don't charge they waive the deductible, so you don't have stage 1, even for a name brand medication. Otherwise, it's the exact same thing. Okay. All right, so last few things here. On your Part D for your prescription, you have the cost of whatever carrier you go through, unless you do a Medicare Advantage plan, which of course we know it includes it. But if you made too much money, remember our Part B premium chart? This is the exact same chart. Unfortunately, what the government does is they say that if you're not in the lowest bracket, which there would be no penalty if you're in the lowest bracket, it's just whatever the cost of your prescription plan is, they're going to charge you a monthly penalty, a IRMA penalty, over and above whatever you decide to do. It has nothing to do with what company you pick. This is totally with Medicare and Social Security doing this to you. Okay, but again, as income goes down, this is where you appeal, and this is where they will lower it if you fall into a lower bracket as the years go on. Okay, so you've got 2 potential penalties that you can pay based on your income level. Your Part B premium is whatever it is, but then you might have a higher one because of income. And then on your Part D, whether you do an Advantage or a standalone prescription plan, you have no additional cost if you're in the lowest bracket, but there's where you have that additional monthly penalty. And again, this is a penalty per person, not per household. So if both husband and wife are on a plan, this is per person. Okay. All right. So when to sign up, here's when you do it, is 3 months before you turn 65. So you have a 7-month window, what's called the initial enrollment period. 3 months before, the month you turn 65, and 3 months after. So you need to sign up for Medicare 90 days before the month you turn 65. So if my birthday is in March 12th, let's say, so I would need to sign up in, was that December, right? Because then January, February, March. Yep, so that'd be 3 months in advance. So anytime in December, I would want to sign up for Medicare A and B, assuming I'm not going to continue to work and stay on my group plan, right? I would sign up. The reason you want to do it in advance, that 90 days out, is because your plan, it takes about a month for Medicare to approve you, and then they mail you out your Medicare card. So you're looking at 4 to 5 weeks before you get that card. You cannot sign up for any plan until you have that card in your hand, because it has a unique number on it that you have to know to sign up for any plans we just talked about. And without that card, you can't do it. So don't procrastinate, because if you procrastinate, and let's say your birthday is November 2nd, and here we are on October 25th, and you haven't signed up yet, there's no way you can get on Medicare, because it's going to take a month. So you'd have to wait then until December 1st, because it can only start on the first day of a month. You'd have to wait till December 1st to get coverage, so you wouldn't be covered on Medicare in November. So not good to do. So always sign up in advance. If you do not sign up within this 7-month window, there's where you can have a 10% penalty when you do sign up in the future for each year that you didn't go on it, which is what we talked about a little bit ago. Okay, so just sign up for it 90 days in advance before your birth date. Now, if your birth date's on the 1st of a month, you actually start on Medicare the month prior. So if my birthday's on March 1st, Medicare actually starts February 1st for me. If my birthday's on March 2nd, or any time after March 2nd, starts March 1st. But be careful, if your birthday's on the 1st of a month, you start 1 month early. Okay, so real important, because you got to make sure it fits within this time window. All right, so other couple things that are important, and we'll wrap up this session. We just talked about the initial enrollment period. Then you have what's called a special enrollment period. So for those people that are going to continue to work and stay on their group plan and not go on Medicare when they turn 65. So when you decide to retire, doesn't matter when it is, it could be at 66, it could be at 79, whatever it is that you come off that group plan, there's where you would have what's called a special enrollment period, that you're eligible to get onto any plan you want. All the ones we just talked about, no questions asked, no penalties. As long as you sign up for Medicare and have it start real close to when your group plan is going to end, when you do sign up down the road, and you would have no penalties, nothing at all, and you get to sign up just like you turn 65 for the first time. Okay, there's one other special enrollment period for anybody that has an Advantage plan or a prescription drug plan, and that would be if you move out of that coverage area, like I mentioned earlier. So you move outside of that service area, now you got to pick a new plan in the new area that you move to. Or if you lost your coverage for whatever reason, which hasn't happened in our area for a long time, but if a company decided just to get the heck out of that market, you would have automatic rights to get covered, no questions asked. And there's also what's called star ratings on plans. A 5-star plan is the best. Most of the ones in our area, 3.5, 4, 4.5 stars. There are some 5 stars, but there's not a bunch of them, but they're rated. And so if you had a plan that wasn't 5-star rated, you do have an opportunity one time a year to switch anytime you want to that 5-star rated plan, no questions asked. Now the general enrollment period and the open enrollment period, I'm going to kind of skip past real quick because those are for people that did not sign up when they were supposed to. And that's when they can only sign up to go on to Medicare in the future and have their penalties imposed on them. So hopefully nobody's going to do the general enrollment one, because that just means you didn't do when you were supposed to do back at 65. The open enrollment's just for those people that went on to a Advantage plan and decided they wanted to go back to a Medicare supplement. So they switched, but they do have to qualify by health. So it is important to know that it's not guaranteed. You have to qualify by health. Now, the one that we're in right now is what's called the annual enrollment period. That is only for Advantage plans and prescription drug plans, not for Medicare supplements. Okay? Only Advantage plans and prescription plans. That lasts from October 15th to December 7th. And that means that anybody that has an Advantage plan or prescription plan can shop around, do whatever they want, figure out if they want to change, and they can pick any other company they want that does those same things, and they can move to them, no questions asked, guaranteed, with their coverage to start January 1st. So there's a lot of people. That's why you're seeing all the things on TV and the radio, advertisements coming from everywhere, because they all know this is when those people can do it, so they're getting bombarded. Okay? All right, so some of these we've already talked about, but if I'm still working covered by group insurance, obviously you can stay in your group plan, enroll in A, but don't do B. No penalties or no loss of options in the future, like we said. Or maybe Medicare gives you better benefits than your group plan does. Maybe it's cheaper. I don't know. I've had that happen before. But if that's the case, you could go ahead and still work, drop off your group plan, and go on to Medicare and pick which plan you wanted if that worked out better for you. Your choice. What if I'm retiring but not collecting Social Security yet? We already mentioned that you would need to sign up for Medicare 90 days before your birthday. So you can either contact the Social Security office, or you can go to medicare.gov and enroll for that to start the first day of your month. And as I mentioned, your Part B premium will be billed to you quarterly since you're not collecting Social Security yet. And then the last one, what if I'm already collecting Social Security? The nice thing for these people is Medicare already signed you up for Medicare A and B prior to your 65th birthday. So you usually will get your Medicare card about 2 months before your 65th birthday, and you've already signed up. There's nothing you have to do other than select then, of course, do you want to go on a Medigap or Medicare Advantage plan to start that first of the month when you turn 65. So that's only for the people that are collecting Social Security already. Okay? And then here's what your card looks like when you get it. So there's that unique number if you see there. And I mean, everybody's is different, but you can see it's something that you couldn't even make up if you tried. So there's where it's real important that you do this stuff in advance so you get that card in your hand, because again, that's a number that we have to have in order to sign you up for any plan at all. Very important that you get that. Okay. And then as far as some basic costs, on the left, you can see the Medicare supplements. You can see the Part A is $0, like we talked about. The Part B, again, $148.50 is the cheapest. It could be whatever, depending on your tax bracket. And then Medigap Plan G, assuming we did that, the basic cost there, you're looking about around $105 a month. Now, females can be cheaper, men might be a little more expensive. Some companies, you know, are a little more or a little less than 105, but that's right in line with what you're going to find. Okay, and the Medicare Part D premium, you're looking at a separate for the prescription plan, around $15. You can find some that are a little bit cheaper, you can find some a little bit more, but really the best one for you is the one that's going to cover your prescriptions the best. And there's where when we run them in our system, it'll tell us which one's the best. And of course, the cost of that plan is the cost of that plan, but it's the one that covers yours the best. So you can see your total cost in that instance, $268.50, based on those scenarios there. Versus if we go to an Advantage side, we know our Part A is free still, our Part B is still going to be whatever it is, so that's still, we're paying that. And then the Advantage plan, again, most of them are going to be zero premiums that include the prescription and the hearing and the dental and the vision, so you can see what our monthly cost is there. So in this instance, we're saving $120 a month, so a little over $1,400 a year. So there's where we look at, okay, if I'm healthy, how many times might I go to the doctor or hospital and my $1,400 savings starts reducing because of the copays? But if I don't go, then I'm saving that $1,400. So there's where, again, when we look at them, you can kind of see what's best for you. Okay, questions on that before we wrap it up?
I do have a question, Craig.
Yes, go ahead.
So if somebody chooses Medicare Supplement, Medicare plus Medigap Plan G,
Yep.
they think, oh, I have a peace of mind now, pretty much 100% covered, right? So what happened if they traveled out of countries, or would that be covered?
Yes.
Something happened?
Yeah, there is coverage under supplements and actually Advantage plans that do cover out of the country. It is limited because they don't want you to, you know, be in some foreign country for the rest of your life, and so for example, they cover $250,000, and you get it, and it's covered on an 80-20 coinsurance basis. So the whole goal is to get you back to the United States for your care then. But they do cover while you're gone. They do cover, it's more for an emergency than it is, you know, I got the sniffles and I want to go to the doctor if I'm somewhere else. But it's more of an emergency in case some life-threatening thing happens to you.
Do they have to pay extra?
Well, you would actually pay it, and then Medicare would reimburse.
I got it.
Yeah.
Thank you.
Yeah, no problem. Great question. But you would be covered for an emergency, gosh forbid something happens. All right, any other questions on costs? All right, so there's my name and number and email address. So if you do have any questions, feel free to call me, email me, text me, whatever works for you. And I'll be more than happy to try and give you the right direction of what to do and how to do it. Okay? So are you okay if we just take like a 2-minute break and then come back and do the Social Security one? Is that okay?
That sounds great.
Okay, very good. 2 minutes and we'll be back together.
Okay.
Thank you.
Yes, we're ready.
Okay, perfect. All right, so in this session, we're going to go over Social Security, and we're going to go through the top 10 things that you probably should know about Social Security. The first step here is just to tell you again, I don't work for Social Security. I've just done this for a long time helping people. So it's just from my past experience and education. So the things we're going to talk about is, will it be there in the future? That's always a hot button. Where does Social Security fit into your retirement plan? How are the benefits calculated? That's always interesting to see what people think. When can I start receiving benefits? What is the best age to claim? And then what if I continue to work? What are the 3 types of spousal benefits if you're married? And how are Social Security benefits taxed? Secure Act changes, which was a law that was passed about 2 years ago. So we'll talk about the importance of that on this. And then finally, how do I file for benefits when I'm ready? So as far as Social Security itself, it's a unique asset because it does provide lifelong income. It is inflation protected. As we mentioned in the last session, they have announced that there's a 5.9% increase for next year for Social Security recipients. It is tax favored, which we'll talk about that as we go through this. It's not subject to the market, which that's been a topic of conversation about potentially letting people maybe invest in the market instead, but as of now, that's not. Spousal benefits do continue when someone passes. We'll talk about that, and it is a government promise as far as it's backed by the United States. So when it first started, was signed by President Roosevelt in 1935. Payroll taxes were collected for the first time in January 37, and that's, of course, when people didn't live quite as long. So the life expectancy was age 63, which we know it's about 20 years longer than that now. So that's caused some of the problems, obviously, with it. Now, what's ironic is the first person to receive a retirement benefit was Ida Mae Fuller, and she was in Vermont. She started getting it in 1940, and she got $22.54 a month. And based on inflation today, that'd only be $403, but back then it went a little longer. She lived to actually age 100, so she really lived longer than that age 63. So she kind of broke the bank on him on that first one, and you can see her total payment was almost $23,000. So it can be a significant amount of money, as we'll talk about, for some people over the course of time. But today it is the most common source of income for retired workers, or for retirements people. And it's about 175 million workers are covered by Social Security, with about 50 million receiving some sort of retired worker or survivor benefits. And as I mentioned, that the 2022 is a 5.9 increase. The average monthly retirement benefit in 2021 is $1,543. Again, that's the average. So yours may be higher, lower, right at it, but I'll tell you how you can find that out. So the big thing is, will it be there in the future? And that's always been the topic of conversation for a while now. We know in a lot of the elections that used to be a very hot topic, but it seems like the last few while it hasn't really been as hot. And I think because they all know that there's some major changes need to happen. And unfortunately, nobody wants to be the bad person that has to do them, because they know they're not going to get reelected, because everybody's going to be mad at them. So, but for many years, it did operate on a surplus. Today, because of a lot of changing things, as we know, there's a lot of concerns whether it's going to be around. And the most recent, based on government data, says that the full benefits are only funded through 2034, assuming that there's no changes. So after 2034, they anticipate that only about 75% of future benefits will be available. So what does that mean? Does it mean that they're going to cut people's numbers? They're going to do whatever? I don't know. Nobody seems to want to address it. They have other needs, apparently, that they want to address. But the common things that they've talked about with changing it or fixing it is increase the wage base. Right, we need more people working, which we know right now that's a problem as well. Increase the payroll tax, which that's usually not something people want to do, is be taxed more, or increase the full retirement age. So we know that that's been done in the past, and we've heard for years and years that they've thought about increasing it. It's just not been done, as I said. But there's probably going to be a combination of those, if not all three of them, that probably have to happen to avoid what's coming, and it's amazing, not that many years more down the road. So the way that you find out what your number is going to be is, one, if you're under age 60, you can only get it online. There's no paper statements. You would go to ssa.gov. And you would go in there. If you've never created an account, you'd create an account, username, login, password, all that fun stuff. It'll ask you a bunch of questions to make sure you are who you say you are, and then you can go in there, and it's a 4-page report that you can see what your projected numbers will be. I encourage everyone to do that, just to make sure that it shows what your past income levels have been over the course of the year, because that is what it goes by. A big part of it is what your past taxable income has been. If you're over age 60 and you are not receiving benefits, and you have not signed up online through ssa.gov, they will still mail you a paper copy. So some of you probably remember back years ago, you used to get it about 2 months before your birthday. It was green and white, 4 pages. So that's what you got to get now online, unless you fall into the over age 60, not receiving benefits, and haven't signed up online yet. Okay, but I, again, encourage you to go in there and definitely see what your projected numbers are. So at the very bottom of that first page, it says this: Social Security benefits are not intended to be your only source of income when you retire. On average, Social Security will replace about 40% of your annual pre-retirement earnings. You will need other savings, investments, pensions, or other retirement accounts to live comfortably when you retire. So there again is Social Security telling people, you need to do something on your own. Don't count on us being your only source of income, which we know for many years, unfortunately, that's what it was, or people had a pension, which good luck getting one of those nowadays from the company. You have to save some additional money on the side versus just Social Security. Okay, so where does it fit in? Obviously, it's money that we're going to get, right? We hope, and going to take it. So if they're going to give it to you, take it, right? You paid taxes to get it back again one day. Some of you may be lucky enough to have a pension or a 401k or an IRA that you've contributed to, or some personal savings, or maybe you're still going to work. Maybe some people have some money in annuities that pay them an income for the rest of their life, or have some life insurance that has cash value you can use, or some rental income. So there's definitely a bunch of pieces to the puzzle, right, that may combine to what your own individual plan might add up to. Now, how much money will you get from Social Security? Well, let's just say in this example, this person's going to get $2,168 a month. So that's about $26,000 a year. Assuming that person lives to age 90, they'd make about $841,000 from Social Security over that course of time. So I have some people that tell me, I'm not even counting on it. I don't even want it. I don't know, if I went to the gas station and bought a lottery ticket and they said I won $841,000 and going to pay me $2,000 a month, probably not going to turn it down, right? So I'm sure a lot of us feel that way, but it is a good amount of money that is yours. Again, you paid into it, so that's how you're getting it back. Now, how it's determined, well, this is where I stump a lot of people. I hear a lot of different answers, and this is how it works. So the two main factors are your earnings history. Again, why I told you to go in and check what your earnings history is on your statement, because if something's wrong, that's going to affect what your numbers are going to be. And of course, the age that you begin at, which we'll talk about that here in a second. To be eligible to receive Social Security, you have to have worked for at least 10 years, 40 credits, 10 years. Okay, that's the minimum. Now, how they determine what your number is going to be, it's the average monthly earnings indexed for inflation using the highest 35 years of earnings. Okay? The highest 35 years of earnings. So that means if I'm 65, right, they're going to go all the way back and whatever my highest 35 years are. If, like my wife stayed home for many years with our kids, so she might have zeros in some of those years of her top 35. She might have, back when she worked a part-time job in high school, might be the highest in her 35. But it's the highest 35 years. So the more you can do, obviously, the higher the number is going to grow. Okay, but there's where most people don't know that's how it works. Very important. Now, when is your full retirement age, which means when can you get the full amount you're due without any type of reduction? It's based on the year you were born. So anybody turning 65 this year was born in 1956. So they would actually have to wait till they're 66 and 4 months. Now, keep in mind that we just talked about Medicare just a little bit ago, and Medicare, as we know, you can start at age 65. So if somebody retires at 65 and goes on Medicare, technically they got to wait another year and 4 months if they were born in 1956 to collect their full benefit from Social Security. You can see that it goes all the way up to 1960 or later, it goes to age 67. And that's the highest. So again, they've been talking about for years increasing that to 70, 72. Who knows what will end up happening, but I got a feeling it's definitely going to get raised at some point. Okay? Now, anybody, you can win a prize if you know when they changed this. Any idea what year this was changed? 1983. Nobody remembers it. Was way back then of when they enacted these new numbers. But that's when they changed the law. This was the new number chart. Okay, so what happens if I take money early? Well, if I take it as early as age 62 is the earliest I can take Social Security, I would have a 25% reduction of what my full benefit would be at my full retirement age, as we saw in that last chart, 66 and 4 months or 67, whatever it is, depending on the year I was born. So a 25% reduction for the rest of my life if I want to take it as early as age 62. If I wait to my full retirement age, my 66 and whatever months, or 67 for some people, I get my full benefit, whatever that full benefit is. Now I can delay it. So maybe I'm going to continue to work. Maybe I've done a good job of saving money, or I just don't spend any. I don't know. But I'm going to delay it all the way to up to age 70 is the latest you can delay it. Every year you delay it past your full retirement age, you get an automatic 8% increase in that number for the rest of your life. So if I was to delay it from 66 and whatever months to age 70, you can see that I'd get that'd be 4 years, a 32% additional amount added to my Social Security benefit on top of whatever cost of living adjustment. So that 5.9% we talked about, it would be on top of that as well. So it can definitely increase the longer that you wait, if financially, of course, that you're able to do that. Okay, so if we kind of look at this in numbers or a chart here, so let's say at 66, my full benefit was $2,000 a month. I know that if I take it at 62, I get the 25% reduction, so I'd only get $1,500 forever then. Or if I was to wait until 70, my $2,000 grew to $2,640 a month because of my 32%, 8% a year for those 4 years. So again, can add up. Now, when is the best time to do it for you? Here's kind of a break-even chart, if you will. So let's say that if I'm comparing taking it at my full retirement age versus age 62, if I go down to right below age 80, so I'd say right around age 81, 82 is, if I live past that, it would have been better for me to wait and start taking it at my full retirement age versus take it early. If I'm not going to make it to 81, 82, it might be better to take it early. And there's where health can come into play, obviously, and some other factors that we'll talk about in a second. Now, what about at my full retirement age versus waiting potentially to age 70? There's where we got to go down to about 86-ish. So if I'm going to live past age 86, probably would be a better deal if I waited to take it as long as possible versus take it at my full retirement age, right? But there's where there's other factors that come in versus just numbers on a chart, and we'll talk about those coming up, okay? But I get that asked a lot, is when should I do it? Well, I need to ask you a bunch of questions to kind of pinpoint that a little bit better. But if somebody could tell me exactly when they're going to pass away, I can definitely tell them when that's going to be. Unfortunately, none of us know that, which is probably a good thing. Okay, so the big thing is there's no single best age. Everybody's different, right? I get people that say my neighbor told me to take it early, or my best buddy at work told me to wait as long as I could. Everybody's situation is different. You can't go by what somebody else does. You got to go by what your situation looks like. So benefits, again, based on earnings, life expectancy, and the age you elected. The factors that are going to factor into this, like I mentioned, your health. If you're unhealthy, maybe you take it early. If you're very healthy, probably better if you wait. Marital status is a big thing. We'll talk about that when it comes to spousal benefits, because if I'm married and I'm the highest wage earner, and I take it early, that's going to affect my spouse's numbers. So I need to factor that in too. Desire to continue to work and access to other income sources of Social Security is delayed, of course, right? So a lot of different things are going to go into play, but the break-even chart helps a little bit when you factor in these other things as well. All right, any questions on kind of what's the best age? Sorry, I getting dry from all the talking. All right, so what if I continue to work? So they have what's called an earnings test. Most likely, you should not collect Social Security benefits if you're going to continue to work and you're under your full retirement age, because you're going to have a problem with not getting it all. So what it says is in 2021, if you earn more than $18,960 working, Social Security will deduct $1 from your benefits for every $2 you earn over that number. So let's say that you're making $48,960, so $30,000 over that number. So you're going to get deducted $1 for every $2 over. So that would be $15,000 would be your dollar for every $2 over. If you're making $48,960, you'd get deducted a dollar of that 30,000, so you'd have 15,000 they would deduct. So let's say my Social Security benefit is $1,500 a month. I'm making $18,000 a year, but they're going to deduct 15,000. I'm really only making $3,000 over the course of the year. Probably not a good idea to take it early, because that's going to be the way it is for the rest of your life, is that deduction until you quit working. So again, don't take it early. Now, the year that you turn your full retirement age, so you're 66 and whatever months it is, you can earn up to $50,520 without having any type of reduction. The year after your full retirement age, you can make as much as you want, collect Social Security, no deduction. Okay? Again, I can't stress enough. Most likely do not take Social Security while you're still working, because they're going to reduce your benefit. It probably doesn't make sense to do it, because that reduction is going to last for the rest of your life. Okay? All right, and the last one we talked about Social Security or Medicare, and we talked about the Medicare Part B premiums, so we don't need to dwell on this one, but there's the charts again, and the only reason I show this, because again, this is the number that will be reduced on a monthly basis from your Social Security check for your Part B premiums for the rest of your life, or again, is billed to you quarterly until you start collecting the Social Security benefits. Okay, so let's talk about the types of spousal benefits. We got the spousal, divorced, and survivor benefits. And so the way this works is, if I'm married, I can claim either on my own benefit or my spouse's earning record. Okay, so if my spouse has made more money, I potentially could file on their record and potentially receive more money than what I would receive myself. Now, how that works is, spousal benefits are 50% of the working spouse's primary insurance amount if taken at their full retirement age. Okay, and I'm going to have a chart for us on the next coming up, so it makes more sense. But basically what that means is let's say my spouse was going to get $3,000 a month and my benefit was only $1,200 a month. If I filed on my spouse's, I'd get 50% of her $3,000, so I'd get $1,500, which is more than my $1,200 I get, so I'd get the $1,500 instead, as long as I took it at full retirement age, because then there's no deduction. Okay, so if your own retirement benefit is lower than the spousal benefit, Social Security will pay the higher amount, as I just mentioned. All right, so let's look at a little case study here. So Diane is not eligible for retirement benefits based on her own work record or her own PIA, primary insurance amount, which is her Social Security benefit, is less than the spousal benefit available. So Bill, in this example, his at his full retirement age is $2,400 a month. So therefore, Diane could receive 50% of that, or $1,200 a month, as a spousal benefit when Bill files for his own worker benefits. Now, that's an important thing there. It says as a spousal benefit when Bill files for his own worker benefits. If you're going to claim on your spouses to get their half, your spouse has to claim first before you can claim on theirs and get their half. Okay, so Diane can't claim on Bill if Bill is waiting to collect his in the future. She has to wait till he starts getting it so she can then start collecting her half on his. Otherwise, she's got to collect on her own or wait. All right, so in this case, Bill would get $2,400, Diane's going to get half. So they're going to get $3,600 a month, which is $43,200 a year. Okay, so to kind of put that into this scenario here, if we go to the middle one, the full retirement age, so Diane files at her full retirement age, her spousal benefits would be $1,200, which is 50% of Bill's, like we talked about. And again, Bill must receive benefits for Diane to start collecting as well. Now, what if Diane wanted to start collecting earlier than her full retirement age? Maybe Bill's older. So if Diane claims before her full retirement age, her spousal benefit would be permanently reduced. So Bill must also be receiving benefits for her to do this, though. But for instance, if she applied for spousal benefits at 65, or 62, excuse me, at 62, her half of $1,200 that she would get at her full retirement age would be reduced by another 35%. So there's where if you take the $1,200 she should have got, take off 35%, that's $420. So $420 minus the $1,200 leaves her with $780 is all she's going to get for the rest of her life. Never going to change other than a cost of living adjustment. Okay, so if before full retirement age, she got reduced 50% and she took it early, she got reduced another 35%. That's a pretty big reduction. Okay, so now what if she waited until after her full retirement to claim her spousal benefits? In this case, she wouldn't do that, because what happens is, we saw earlier that somebody, if they wait past their full retirement age, they get that 8% automatic increase we talked about all the way up to age 70. Unfortunately, when it comes to spousal benefits, the spouse doesn't get to get the additional 8% numbers. They only get what the full retirement benefit was for the spouse they're claiming on. So in this case, she would not want to wait any longer. As soon as she hits full retirement benefits, assuming Bill's collecting his too, she would file and start getting her 50% at that time. Okay, hopefully makes sense. Any questions on that?
What happens if Diane has her own pension? Will the government pension offsets kicks in, and what would that happen?
It can, yes. There can be reduction if you have a government pension. I don't have the rule right in front of me, unfortunately, but there can be a reduction if you're getting Social Security and you're getting pension through the government. There is a small reduction that can happen as well.
Okay.
Yep, but I can get you the specifics if you'd like me to afterwards.
That would be great.
Okay, no problem. All right, so let's talk about divorced people. I'm just making a note of that so I make sure and get it to you. Pension, there we go. All right. So the eligibility for a divorced person to receive to receive divorced benefits is both the spouses have to at least be 62 or older, because again, that's the earliest they can claim as divorced, right? As for Social Security is 62. The marriage had to have lasted for at least 10 years. They have to have been divorced for at least 2 years or longer. The claiming ex-spouse is unmarried, so if I'm going to claim on my ex-wife's benefits, I cannot be remarried. If I get remarried, there's where now I'm tied into the new person I'm married, not my ex. So there's where sometimes you see that people live together and don't get remarried again because they might not get as much as they would off their ex. I mean, they're playing the game, unfortunately. And then the former spouse can be remarried and doesn't have to file for benefits. So if my wife and I got divorced and I wanted to file on hers, again, I can't be remarried to file on her, but she can get remarried, has no effect on anything because she's still going to get hers. Okay, so I can collect spousal or survivor benefits based on my ex-spouse's work record. It has no impact on the former spouse's benefits. So here's where I get questions all the time, or not really questions, more statements. I get where there's a divorced person and they say, I do not want my ex to claim on my benefits. I don't want them to get anything. Now, I'm here to tell you that it has no bearing on anything. You'll never know. It doesn't affect yours. And that's why I tell them. It has no impact at all on yours. You will not even know what happened. Nothing changes for you. So, but they're just upset, I guess, from being divorced. So they just go into that. But it won't affect. Now, if you do collect Social Security as a divorced person on your ex-spouse and you're still working and you're under your full retirement age, you still have that earnings test that we talked about, where if you make over a certain amount, there's where they'll reduce it. So again, if you're still working, do not collect even divorce benefits. It would not make sense until you hit full retirement age. Okay? And then survivor benefits. Available to widows, widowers, ex-spouses, surviving ex-spouses. Must have been married at least 9 months, so that's the rule, versus the married ones were 10, or divorced ones were 10 years. Here it's 9 months, except in the case of an accident. You can collect survivor benefits as early as age 60, so it's not 62 here, but again, there's a reduction if you collect it that early, so I'd be careful. And currently widowed or remained or remarried after age 60. So you could potentially get remarried in a survivor situation and still collect on your ex-spouse or your spouse that passed away. You still could collect on theirs even if you did remarry in this case. Okay, but again, you would get reduced benefits if you take it as early as age 60, even more than what it would be at 62. And actually, if you're disabled, they'll let you take it as early as age 50, but again, with some reductions. So a lot of times doesn't make sense. And again, it is subject to that earnings test again, even as a survivor benefit. So if you're under full retirement age, just be careful collecting it if you're still working. Okay. So as far as survivor benefits go, what happens is at the death of the first spouse, the surviving spouse will receive the highest of one of these three. Either still get their own benefit. If they had the highest benefit, they'll just keep collecting theirs, and the lower one of the spouse that passed away will go away. Or they'll get the benefit of the deceased. So if my wife passed away and her number was bigger than mine, now I get hers, but my number goes away. Or you get 82.5% of the full retirement amount benefit of the deceased. So that would only be in the case where somebody took it earlier than their full retirement age and they had that reduction. So in this case, they might get a step up from 75% of the benefit to 82.5 instead if that number is bigger than what the survivor person's benefit is. And again, the lesser one disappears. Whichever one happens, the lesser one still goes away. Okay, so that's what I'm saying before is if you're married, if you're the highest earner and you take it early, just remember, if you pass away, that's the number that your spouse is going to get, and their number is going to go away. So a lot of times it's better for the person making the least, would get the least Social Security benefit, to file, collect that, have the higher earner wait as long as possible to build that number up as much as they can. So that way they get a higher number for the rest of their life. And that way, if one of them passes away, either one of them then receives that higher number still for the rest of their life. Okay, hopefully that makes sense. But there's where it comes into play. That's where it's not always just take it as early as you can. You got to figure, if you're married, you got to factor in what's going to happen to the spouse. If you're taking it early just to take it early, they're going to get a smaller number then potentially. Okay. So, as I mentioned, in most instances, it's advantageous for the higher earning spouse to delay their benefits as long as possible, ideally at age 70 if healthy, and of course financially able to do that. Maximizes the retirement benefit and survivor benefit for the widow. And if income's needed, it's better to usually trigger the lower earning spouse's money earlier, and that way they're able to do that. Because what will happen then if the lowest earning person files and the other one doesn't, then when the higher earning person files, then the person making the smaller amount, if 50% of the higher earner when they file one day is more than what that lower earner is making, they'll get a step up to the 50% number. So there's where they get a bonus there as well. So there's where, again, when we run all the numbers, there's where we figure out which way is the best way to go based on everybody's financial situation, what they're able to do. All right. So this just gives you kind of an idea of a software program that we have that we developed years ago, and actually a major company bought it from us, and now they run all these for us, which is kind of nice. Instead of us doing them all, we give them the information, they kick them all back to us. So, but basically what it does, it'll take into consideration as far as your health, income that you have coming in, when that income is going to stop, when do you want to, how much money do you want when you retire, and what other assets do you have to kind of supplement some differences if you don't have enough type thing. And it'll give us a couple scenarios of when is the best time to claim your Social Security benefits. So you can see here it gives a suggested strategy, an alternate, and then the earliest. And then on the bottom, it gives a break-even chart, right? And so basically what did is Bill and Diane in our scenario from before, they said, all right, Diane's going to expect to live to age 90 and Bill age 85. So then it runs these scenarios based on that. And you can see that if basically they both pass away about prior to 85, 86, it would have been better for them to take the earliest possible combination of benefits. So filing as early as possible, most likely. You can see there's a very small little window for them taking the first alternative. And then, of course, if they live past age 86, either one of them, you can see that it definitely is better for them to wait as long as possible. So then it kicks out this chart and it says, okay, Bill, based on the information you provided, how long you plan on living, other income you have that you may be able to live off of until Social Security kicks in, and what you want when you retire, here's what you need to do. In June of 2024, when you're 69 and 6 months, you notice it's not 70 because at 69 and 6 months, they hit their limit of what the income that Social Security will provide them, in addition to some of their other income sources, it will get to that number that they said they wanted. So it's going to pinpoint exactly to the month and the year, or the exactly when they should start taking it. So he would file then in June of 2024 at 69 6 months and start receiving his first check in July, the next month, of $3,325. We know in our example that Diane had to wait until Bill filed because she wasn't able to claim on her own for whatever reason. And so she would then file hers as well in June of 2024 and receive her first check in July of 2024 of $1,298. Now again, Bill's getting $3,325, she's getting $1,298. Remember, that's not half. Now, why isn't it half? Because she's only getting half of what his full retirement benefit was, not what it is for him to go up to 69 and 6 months with those automatic increases. She does not get the benefit of that, if you remember us talking about that. Okay? But based on their situation, that's exactly when they should file, based on what they said they wanted to have done. That's pretty just point blank. There's what you said you wanted. Here's is how you do it. Okay. So you can see the chart just shows Bill's money coming in as retirement income benefit. Diane's coming in. Bill passes away, unfortunately, at age 85. Then she gets the widower benefit and that type of thing on the bottom. Okay. So what happens once in a while, as you saw on the other chart as well, but this one pinpoints it a little more, is sometimes when you factor in a pension, your Social Security benefits, and whatever else you got, sometimes it might not add up to exactly what you want. That happens sometimes, right? Maybe we didn't save enough or whatever the case might be, and so now what do we do? Well, so what we do sometimes is we can show them what's called a lifetime income plan, because that's what we hear from most people that are getting ready to retire, is I don't want to outlive my money. I don't want to be broke one day, right? And so what we do is we can run a scenario for them and show them exactly what they got to have as far as in 5-year segments. So this one, segment 1, just shows $6,000 a month. So let's say that's what they wanted to have on a monthly basis. The income floor represents the Social Security benefit, which we know they're not getting that yet because he's waiting until 69 and 6 months. So the $6,000 a month here has got to come from their current investments or working longer, wherever it's going to come from, right? And then segment 2 is at age 70 for the next 5 years. So now they start their Social Security. So now they got the $4,000, let's say, coming in from Social Security, and with inflation, they've got to supplement $3,920 from other income sources. And you can see segment 3 goes into 75 and 80 and 85, for example. So you can just see what inflation does. As we all know, it gets a little scary. We're all living it right now, unfortunately, in a lot of ways. But this is how we can show them how they can have their Social Security whenever it's going to pay, whatever other income sources they have, other money they've got, whatever, and try and show them a plan of will it last as long as they want it to. And sometimes it might not. It might say they're out of money at age 83. So, but it's better to know when you're 62, 3, 4, or 5 to know that I better do something now versus I get to age 80 and go, oh, geez, I'm out of money in a few years. It just helps with hopefully peace of mind or finding a solution to fix the problem. Okay. Obviously, if they have a financial advisor, they could probably do this for them as well, but just something we can do as a free service if somebody wants us to help them with that as well. Okay, so not to get technical there's where people might invest in certain investments, whatever. We're not here to do an investment class, but there's where they pick different investments depending on their longevity of money needs to grow. So let's talk about taxes and how things are taxed when it comes to Social Security. So we've got different income streams potentially. You've got ordinary income taxes on employment income, pensions, 401k or IRA withdrawals, interest on savings, or short-term capital gains. Then tax favored is going to be Social Security, long-term capital gains, and qualified dividends. And tax-free, as we know, are different Roth IRAs and 401k Roth accounts, cash value life insurance, and municipal bonds. All right. So what happens is Social Security decides if you're going to be taxed or not by using something called provisional income. And basically provisional income is they take 1/2 of your Social Security benefit added to any additional wages, pensions, and investment interest, 401k or IRA withdrawals, not Roths, of course, but any of that added to your half of your Social Security benefit, added to any non-taxable muni bond interest. They add those together and come up with a provisional income. And then they go to this chart, and this chart hasn't changed forever. Hopefully they'll do it at some point. But the way it looks, depending if you're a single filer or a married filer, let's say the person's married, Bill and Diane, if their provisional income is less than $32,000, they would have 0 taxes to pay. If their provisional income is between $32,000 and $44,000, they would pay taxes on half of their Social Security benefit. And if they're over $44,000 in provisional income, they would pay taxes on 85% of their Social Security benefit. Questions on that? Remember, this isn't income. This is the provisional income number based on, well, let me go back, based on those numbers that we saw as far as half of Social Security, any other income, withdrawals from their IRAs, 401k stuff, right, pensions, added together to determine this. Okay, so some people potentially could live tax-free at retirement. They can have their provisional income, they can have some money coming from their Social Security, they can have some money coming from IRA 401k withdrawals, they could potentially have a pension. Obviously, if all those are below a certain level, they're going to have 0 taxes on it, which isn't a bad deal, I guess, if that's where you fall. And for some reason, this isn't, there we go. All right. So this is just kind of reiterates my point, but capital gains and IRA withdrawals, Social Security, and all those things could potentially be non-taxable, but you start adding them all together and now we got some taxes going on, right? So the whole goal is to try and reduce taxes as best we can, especially at retirement. So let's take a little case study here and say Bill and Diane again are both age 65. They're married, filing jointly. They've got their Social Security benefit. They've got their ordinary income coming in the door. And now they want to withdraw $20,000 because, I don't know, maybe COVID's over. They want to go on a European vacation, whatever they want to do. So where should they take that money? And again, I'm not a CPA. So your CPA hopefully can do this for you. But this is a software program we have to help people in case they don't have access to this stuff. So based on our story that we saw, based on them making their Social Security and their ordinary income, they would basically have 0 taxes due on that income coming in the door. But now they got to take their money, $20,000 they want, from somewhere. So where are they going to take it? Well, if we look at what how their taxes are on their 1040, on their tax form, their Schedule A and everything, basically if they took it out of an IRA or 401k, they'd have to take out $25,081 to get $20,000 because it would produce $5,081 in taxes, basically a 20% tax rate. So probably not what we want to do if we can help it. Or they could take it out of capital gains, out of non-qualified investment, and they'd only have to take out $21,803, which would only produce an 8.2% tax there. So, or it could be somewhere in between. Maybe they got to take some out of capital gains and some out of the 401k IRA, and it ends up being maybe in that 14, 15% number, wherever it is. But it's better to know where to take it from to try and limit the taxes you have, obviously, because it's just a better deal, obviously. Okay, questions on that before we move on to the last few things? All right, so Secure Act. This changed in 2019, and basically there was a bunch of stuff involved in it, but we're only going to talk about the 4 key ones that focus on what we're talking about with Social Security and retirement. But it did 3 good things and 1 not so much. So it increased the required minimum distributions to age 72 for those turning 70 and a half in 2020 or later. So it used to be, obviously, when you turned 70 and a half, you had to start taking out money out of your IRA or 401k because you had to pay taxes on it. The government wants to start getting their tax money, right? Because it's been sitting in there growing without taxes being paid. So they increased that for anybody that turned 70 and a half in 2020 or later to age 72. So it's a good thing. In a year and a half, they get to delay it unless they obviously want to take it out early. It's up to them, but they can delay it if they need to. It removes age limits for traditional IRA contributions. So it used to be at 65, you no longer could contribute to an IRA, and now they took that away. As long as you have some sort of earned income, you can contribute to it as long as you, doesn't matter how old you are. So that's a good thing for those people that want to continue to work and save some additional money for retirement. Here's the one bad one, is it eliminates the stretch IRA. And basically what that means is this is more for your children. So mom and dad save up a bunch of money and their 401k or IRA type thing, and then they pass away and both of them are dead, so now the kids get the IRA 401k. Well, it used to be that the kids could drag out what's called stretch it out for their lifetime and pay taxes on it over the course of their lifetime. So let's say they got $1 million and the kid's 40 years old, you know, that could be 50 years. You stretch that over 50 years, probably not a bad, small taxes do. But now what they did is they said you have to take the money out within 10 years. So anybody that collects other than a spouse that is a beneficiary of an IRA or a 401k, they have to withdraw all the money out of it within 10 years and pay taxes on it. So now you got that $1 million and you take $100,000 a year for 10 years. Well, you know what taxes are on $100,000. That's not a good thing, but that's what they did. Lifetime income options and annuities and retirement plans. So they basically just said in retirement plans now, 401ks and those types of things, they have to add lifetime income options and annuities for some safer alternatives for people with some guarantees versus just equity, mutual funds, those types of things. So when people get older, there's some safety nets, if you will, in case the market goes down right before they retire. So those are the 4 key things that were factored into that. When you decide to file for benefits, the easiest way, to be honest, is go to ssa.gov. The in-person stuff is a little more difficult, obviously, with the COVID. Hopefully that'll loosen up, but one day it will. But when that happens, if you want to sit down with somebody face-to-face, it has to be done with them face-to-face or online or obviously over the phone. Those are the 3 ways to do it. Pretty simple, but the biggest thing is figuring out when's the best time for you, so that way you know. But anyway, Social Security, as we talked about, there's a lot of moving parts. There's a lot of puzzle pieces, but figuring out when's the best time for you is the most important to make sure you maximize your benefits, reduce your taxes, and most importantly, make sure you maximize the benefits for, if you're married, also your surviving spouse, because if they outlive you, they kind of might need that money as well. But if you need help with anything, holler at me, call me, email me, text me. More than happy to help you out, and I appreciate the Memphis library system allowing me to educate you on this, and if I can be of any service, let me know.
Well, this has been wonderful 2-hour workshop full of information. Many of these information are really, really overwhelming for average participants or listener. But with this information, you know, for myself, this is the second time I participate in this workshop. I understand a lot more, but still I would need to learn a lot more. But we certainly appreciate all you have done to educate us, empowering us to taking charge of our personal finance, and especially of retirement, personal finance for retirement, Medicare, Social Security. These are very important topics, and thank you so much. Yeah. Really, really appreciate you Craig Long. As you may be hearing from me personally, I would love to learn more from you.
Yep, I appreciate that. And yeah, this was all hopefully just to get people a little more knowledge. I don't expect anybody to be an expert. The next step is to, if you want to know more, contact me, and one-on-one is really how you learn it the best.
Definitely.
And there's no cost to have me talk to you. So that's the beauty of it, right? It's free.
Awesome. That is awesome. Yes, we always, all these programs are free to our customers, library customers.
That's right.
Free is wonderful, but
Yep.
we thank you. We would like to thank you for taking up 2 hours of your precious time to share your knowledge and expertise with us, and we really appreciate it.
Great. I appreciate doing it. Thank you so much. Love to help anybody that needs help.
Awesome.
Thank you so much.
Okay, thank you. Thank
care.
you everyone else for participating in this event. If you want to learn more about it, go to our library's website, memphislibrary.org, and you can click on the slider that is the 901 Personal Finance. This is the Oktoberfest for more programming. Tomorrow, the day after tomorrow, and the Friday, we have three more programs that are coming up for this series. Oktoberfest 901 Personal Finance. So take care. Thank you for participating and have a great afternoon. Bye-bye.